happy to introduce Dr. Sherita Henry. Sherita, I make sure I'm saying this correctly, is the new director of our public health program.
Yes.
And also a nursing professor in our nursing program. Is that correct?
A professor in the public health program housed in the nursing department.
Okay. See, you can tell I don't spend a lot of time in the academia portion anymore.
No
Well,
worries.
thank you for being our guest speaker tonight. I know this is an exciting topic for a lot of people, whether we're vested in the career side of it or just really want to know about how it's going to really improve Hood's brand across the country here. Mm-hmm. So I'm going to make sure we've got everybody in the room. And before we start, I always like to give Nancy a half a minute to give a quick update, or Debbie Ricker, our provost, if there's anything to share.
Well, I'll just say welcome and allow Debbie to do the same. Thank you for being here. Love having all of you, and welcome to the space. We have a few of our trustees with us, some of our special guests, and just wanted to thank them for being here. Hamp Tisdale, Cynthia Newby, Mike Hosford. We're delighted to have you join us, and everyone else. And just in a nutshell, things are going really well at Hood. We're back from spring break. We're in the final push of the semester, so you can imagine that it's a bit intense on the home front. But we welcome you to come back and see us in person. Lots of exciting things going on. And I'll let my colleague, Provost Ricker, bring her greetings on behalf of President Chapdelaine and the entire community.
Thanks, Nancy. I think you just did that. Yes, we're so pleased to be here with you. It's an exciting time to be on campus. It's that time when all the trees are blooming and the flowers are out and allergies are swarming. It's really a beautiful time. This is the time the campus sells itself. And we're so excited. This Saturday is our first accepted student day. And then we'll have another one next Saturday. We learned at senior team this morning, we have about 270 students registered across these 2 weekends. And so it's a beautiful time to be on campus. And we're so delighted to welcome prospective new students and families to campus and share with them all that there is to be excited about Hood, including our exceptional public health program that is flourishing under Dr. Henry's leadership. She has just been a terrific influence on that program for us, and we're delighted to have her. At this point, it's really surpassing all of our expectations, and we're looking forward to adding a second faculty member in the program in the not too distant future. So just excited to share her with you tonight, and I know you'll be as delighted as we are to have her as a colleague on campus.
Thank you, Provost Ricker.
Dr. Henry, the floor is yours. We are here for you.
All right. So let me first say, good afternoon, everyone. Good evening. If I could get perhaps a thumbs up to let me know that you hear me, any type of emoticon, that would be awesome, as the technology works really well, but sometimes we just gotta get in there and intervene as necessary. Welcome. Thank you for your time this evening. My name is Sherita Henry, and I'm going to share a little bit about the public health program. And what I want to share, hopefully this will be a bit more interactive as we're talking with one another and learning a bit more about the program from your vantage point. But the first thing I want to say about the program, the public health program, is considered to be a standalone baccalaureate program, or SBP, okay? And so the initial course or program was launched in fall of 2020, okay? And I had the pleasure of coming in shortly thereafter in spring 2021 at the top of the year. Exciting times, still exciting times, but okay. So now, sometimes very common question we get, where is the public health program? How does the public health program play into Hood College? Well, we are housed for now under the Department of Nursing. My esteemed colleague, Dr. Linda Kennedy, who is the chairperson. We also have a sister program, which is the Masters of Science in Nutrition program that will be launched courses in hopefully fall 2022. All is going well. And currently we're located in Rosenstock Hall. And in the very near future, we will be transitioning to Frederick Health for the new School of Behavioral Health Sciences. And so a little bit just about the department that public health is housed in, the Department of Nursing. And so nursing currently has one of the more popular majors. It has 156 majors to date. Typically after the sophomore year, students begin clinical sessions. Some of our clinical partners are within a 30-mile radius. And beyond that, for seniors, they sort of venture off a little bit further beyond that to places such as the NIH or MedStar or the Children's Hospital. Currently, they have a state-of-the-art simulation lab. They also have surpassed the national NCLEX pass rate. So the national average for NCLEX rate is about 87%. Currently, the nursing program's pass rate for 2021 was 95.5. So quite an impressive department. And recently, with the state-of-the-art instruction, they were recently awarded funding through the K-Lard Foundation. And so the issue at hand is that currently we have a wealth of different health issues that plague the nation, also plague the globe. Some of the more common leading causes of death, such as chronic diseases as cancer, stroke, type 2 diabetes. On the other side of maternal child health are adverse infant outcomes, such as infant mortality or low birth weight. And so with the number of different health issues, what we have to understand is that the health issues by themselves are really severe, okay? But then when we layer in this piece called health disparities, meaning that, different groups are affected differently and have different outcomes at disproportionate rates, that makes the health issues even more so exacerbated. And so in looking at the health disparities that exist, we understand now that health is influenced by this term that we coin the social determinants of health. And so the social determinants of health, they influence our health outcomes in that, where a person lives is a predictor of health. Where a person works is a predictor of health. Where a person has access to healthcare or worship or pray or play is a predictor of health. And so understanding that health disparities exist is one layer of the public health issue. But then understanding that there are also these structural barriers that come into play that also make these health outcomes even that more alarming. And these health inequities speak to some of the barriers that people experience on a daily basis. So the goal of a program, according to the CDC's guideline, is to address health disparities and bring us that much closer to health equity. And so in doing that, we can look at the nation with a much more positive outlook on the health of the nation. And we can understand that, some of the things that we do with the different programs that are implemented are making communities healthier, one community at a time. And so what does that program speak to in terms of what we're able to do? Well, our public health program at Hood College is one such program that seeks to create these solutions to health disparities and health inequities. And so the vision of our public health program is to prevent, promote, and protect the health of communities. And our mission is to be able to prepare students for professional practice in public health through a liberal arts education as the foundation that incorporates generalist public health professional competency. So in other words, we are building up a cadre of individuals who will serve as instrumental players in the workforce. That is the goal of this program. And so to that point, some of the things that we know about the program in planning through the pro forma is looking at how we want to build the program up and how we want to see the enrollment increase over the next couple of years. And so for the first 3 years, we can see that there's a projected number of students considered to be declared public health as full-time enrolled. And so for our first 2 years, we are ahead of the trend in terms of enrollment. So that is very promising. And we look forward to continue to see those projections to, if not meet the goal, but to exceed the goal of full-time enrollment. And so some of the things that I have had the pleasure of working on is developing the curriculum for the program. And so on the left-hand side, what you see are some of the public health courses that are offered, one of which is considered to be a core curriculum course. But some of the things that goes into the development is, mapping the different enrichment activities and learning activities to the learning outcomes, along with some of the public health competencies that is governed by the accrediting agency, which is the Council on Education for Public Health. Also, aligning with the program foundational competencies. And then for the core course, such as Biostatistics 202, because it's a core curriculum, aligning with that of the college competencies. And this particular course considered a quantitative literacy. So aligning with those domains as well. And so some of the things that have come into play in building up the program is incorporating different experiential learning into the classroom, into the program, into the daily student exposure that they have. And so one being enrichment activities. And so for one of the courses, which is considered to be a research methods course, students were able to earn ethics certification and how they would ethically conduct research. And that actually is an online accrediting body, city online training. And so with that, students were able to earn a 2-year certification in research ethics. That is an example of one enrichment activity. Additionally, students have been able to work in the realm of internships, and the latter courses in the program, which are the capstone courses, really speak to the internships that students will be able to participate in through local community partners. And so the idea is that by the senior year, there are 2 culminating capstone experiences. And so based on students' interests, they would be matched with a local agency and be able to engage in a professional internship or service learning activity. As part of one of the health communication courses, or rather health theories and models and behavior courses, students were able to develop a podcast and assess a health promotion program given their interests. Additionally, research as part of one of the courses, students engaged in primary research. Additionally, through coursework, students were able to generate a CV to set them up for being competitive as it relates to some of those internships that they will be applying for. Additionally, some of our community outreach and engagement are local health agencies and coalitions that serve the local Frederick community in outer regions to build up the local health of the community. And as part of the enrichment piece, there are different expert lectures that serve as guest speakers for the different course based on their expertise to kind of give students that practical vantage point on what the working professional looks like as it relates to public health. And so as mentioned so far, these are some of the partnerships, not all listed here, but the local Department of Health, the Centers for Disease Control and Prevention, and Frederick County Healthcare Coalition, to name a few that I have been able to work with in serving the local community, but also garnering some experiential learning activities for the students. And so as it relates to some research experience that the public health students have already been able to experience, the first opportunity stemmed from the Hood College Summer Research Institute in partnership with the local Frederick Department of Health. Students were mentored by Dr. Jennifer Cooper, who is an associate professor in the Department of Nursing, but she's also served as a introduction to public health instructor when the course was first offered in fall 2022. And so with that, Dr. Cooper was able to select 2 public health students, and they participated in facilitating the local community needs assessment in Frederick that is conducted every 3 years. And part of that process, students were also to engage in reviewing some of the data, the secondary data that was collected. They were also able to engage in generating a research poster and presenting their findings in different settings throughout Hood College, such as the classrooms of Dr. Cooper, myself, and presented to the upper senior team. Additionally, as part of the Public Health 102 Introduction to the U.S. Healthcare System course, last spring, students engaged in a hands-on experience as part of a national initiative implemented by the Centers for Disease Control and Prevention, dubbed the Mask Up Project. And so what that was is that institutions across the nation, 43 to be exact, they charged college students with taking ownership of assessing how well colleges were implementing the mask mandate. And with that process, there was 12 students who participated in this project. 8 of them were public health majors who took the course, and the other 4 were biology and nursing students who took the course. And so through this process, a 10-week project, students were able to, through their observations, they were able to reveal that Hood College was in the upper 90th percentile in terms of faculty, staff, students, and those who frequented the campus wearing masks. So that made the difference in how we were able to remain open face-to-face and not have to circle back to remote instruction. And then lastly, of that CDC project, students went on, 6 to be exact, to submit their research findings to peer-reviewed journals. And of those outcomes so far, there has 1 student that is scheduled to be published in a peer-reviewed journal. And so some of the recruitment efforts that we have made with the program have been in direct partnership with the Office of Admissions with different events one that was mentioned by Provost Ricker that will be happening this Saturday. Additionally, with the marketing department and generating updated brochures and reaching out to local high schools and making sure that the messaging in terms of recruiting high school students is accurate. Also in partnership with the Department of Nursing. Hood College within itself has a very close community college pipeline whereby we have a number of transfer students who are already enrolled in the program, and we continue those recruitment efforts. Additionally, there are some other high school students that sometimes they reach out based upon their interests and would like to shadow the public health course itself prior to making a decision or a commitment. Additionally, undecided majors who attend some of the 100 level courses, that is an opportunity that the program is marketed. And additionally, through some of our local community partners in programming, we try to spread the word as best as we can. And so just to kind of provide a little bit more on who might be interested in declaring public health as a major. So perhaps these are traditional students, but perhaps these are also adult learners as well. But so far we find that, students who would be good candidates for the public health program, or just from my past experience, those who might be good candidates for the program, or those who perhaps take local leadership positions within their community where they reside, perhaps students who have engaged in different type of outreach activities, some that took place during COVID, during the pandemic, and just helping out and seeing what that difference looks like. Additionally, some that take a very key interest in environmental health issues, such as the water crisis, the lead in the water crisis in Flint, Michigan, one who is interested for personal reasons, perhaps, some who maybe at the high school levels, they were engaged in different type of research activities, or they engaged in perhaps advanced placement courses. Additionally, you have students that are part of other types of professional memberships or nonprofits. Typically, this is a good candidate for the program. And sometimes students just come in based upon their personal interest with family. And so sometimes they may have family who are experiencing certain type of health issues, and that makes the difference in what it is that they're interested in doing in the field of public health. And so we also have another number of students who come in because they have had employment experiences linked to the field of public health. And so that helps them to solidify what it is that they want to major in. And one of the things that President Chapdelaine would say that came from COVID is COVID lemonade, is that we can see the positive silver lining of things. Some of the things that students were able to be very clear about is making a difference as it relates to COVID-19 or some of the health disparities witnessed or some of the social injustice issues. And one who is just perhaps maybe they did not have these prior experiences, but they're simply interested in pursuing a professional career in public health. So that in a nutshell are some possible candidates that would be strong for the program. And so one of the other great things that I have been a part of is building bridges and supportive networks in terms of just bolstering the notoriety of the program through looking at local community-based agencies for internships and partnership opportunities. As mentioned, the capstone experience is required for senior public health majors. And so just looking to partner with local agencies who could serve as clinical or field sites for students. Additionally, building partnerships that perhaps one is an expert in the field of public health, and enlisting those as guest lecturers for the particular courses that they might be experts in. Additionally, enlisting stakeholder feedback through my involvement in the local coalition that I am a member of. Additionally, professional development and helping students to have that wherewithal in going out to secure positions once they graduate from Hood College. And so that is important in bringing people in to help students or otherwise mentoring students. And some of the other things in terms of just enlisting people to help in what will be necessary in terms of our self-study as part of the accreditation requirements, and other financial support in terms of some of the things that are necessary at the ground level. And so most importantly, if nothing else, to just spread the word that we are here and we are a major and we are moving forward, and this is something that we have a vested interest in. So building supportive networks is always ongoing on one of these levels or more. And so some of the things that would be considered current and next steps, apart from serving the local community, apart from increasing our faculty, we did just hire an adjunct faculty part-time to teach one of the courses. Apart from research initiatives and apart from building bridges, is making sure that the outcomes that we set forth, that we have the metrics in place for ongoing monitoring and making sure that we're hitting the mark in terms of the things that are deemed important in terms of outcomes. And so also, which is the very hardy portion of it, is the accreditation process. So just to put things in perspective, public health programs such as this with a robust framework could potentially be accredited within a 5-year window, given everything goes according to plan. So some of the things that have been on the radar and that I have worked with admissions is a formal admission process by academic year beginning 2023, increasing that faculty man and woman power. Currently we at 1.5 out of the 2.5. And so as mentioned, we have a full-time faculty that is scheduled to come on board in the fall. Additionally, accreditation speaks to ongoing academic advisement by the public health faculty, tracking those graduation rates, and not only tracking those graduation rates, but once students leave, making sure that they're aligned with different professions that speak to public health. Additionally, ongoing partnership formation that will serve in the capacity as perhaps sites for internships, guest lectures, mentors, you name it. Our self-study process that will be pretty much started once the program launched, even though it's not considered formal, but everything you do, you're creating a record, a database of the different things that you will be assessed on later on. And accreditation is also tracking alumni, and making sure that, when they go off, that their reach is still tied back to the program. And last but not least, documenting different stakeholder engagement, that at a local level, we have people who are vested in the process from start to finish. And so just a little bit about the reference piece. I thank you, and I will now open it up for any kind of questions, comments, caring to share. Here's my contact information, and I want to hear from you relevant to what questions you may have regarding the program.
Dr. Henry, I just wanted to add that on this call today, we have some of our earliest nurses, those who came to the college in the 50s when we had our first nursing program. And I find that kind of amazing. So congratulations to some of our earliest nurses who have joined us tonight.
Did I understand you to say that it takes about 5 years for the accreditation process to work through?
Yes, yes, given all is well, robust, meaning we have basically those metrics listed for accreditation that we're moving in that pattern. And then once you get that accreditation, it's still ongoing. So everything you did to secure that accreditation, you want to keep doing that. And so, record keeping, monitoring, hands-on. In past programs I've been a part of, students actually participated in the accreditation process because it's really, it takes a village. Yes.
Accreditation is important. Obviously, we want to be the best, and that's accreditation. But what else does accreditation do for us officially? I'd be interested to hear.
Accreditation speaks to basically making sure that the degree that students earn basically qualifies them to say that they're public health professionals. And so at the public health level of accreditation, there are 3 different levels. You could be accredited at the undergraduate level, you could be accredited at the Masters of Public Health level, or you could be accredited at the DRPH or Doctor of Public Health level. And so I've had affiliation with institutions and colleges who were accredited at all 3 levels. So it basically gives merit to students to go out and be public health professionals and say that that degree really means something. So although you have an accredited institution, you want the program to align with that rigor, because basically the accreditation speaks to the different competencies that students are able to develop and then parlay out into the workforce and the community that they serve.
Thank you.
You're welcome.
Dr. Henry, I'd love to ask you just a personal question. What got you interested in pursuing the public health field?
Oh my goodness, we don't have enough time for that.
I love seeing your rise through academia, but it's obviously a program that you really do need to bring your heart and soul to, as well as your brain. And I'm just curious as to what brought you to this area.
Well, thank you for that great question. It is actually a number of different reasons. So through my upbringing, so I come from a very diverse city, a city that's very diverse and rich in culture, New York City, the Bronx, New York to be exact. But among that richness in culture, there's also different things that you see that speak to you in terms of just wanting to make a difference in the world of public health. I'm also one of those students that come to the program based upon family members who have experienced a number of public health issues. Also, as a mother, the maternal child health piece spoke to me. And in fact, I was an MPH student while I was pregnant. And so that came full circle. And so many different layers. So I tell the students, I joke with my students when I introduce myself the first day, I say I eat, sleep, live public health. And it means that much to me because so many different aspects of my life have been impacted. That's just, to name a few. And I think that some of the things that I've witnessed put me in a position to really connect with the program. But more than that, I'm not that far removed from the student experience that it allows me to connect with the students and understand their journey through this process, similar to my journey. And then a lot of my research interests, which is the practice side of things that I'm a part of in terms of research, also fuel my academics to bring into the classroom.
You didn't talk too long. I want to hear more.
Okay, so I have something that now.
I think, and I don't know if I'm speaking for everybody, but I love these happy hours. Granted, we set them up through our office, but it really does give me an opportunity to learn about the different programs that I might not know about. And I think what I find to be most interesting about the aspect of the public health program is that you do really focus on the disparity care issue, that everyone brings a different story to their healthcare experience, personal and public. And I think it's great that we're addressing that. I mean, as a graduate of 86 of this liberal arts college, I like that it's an all-encompassing program. I mean, I doubt if I would enjoy the science part of it, but I certainly enjoyed the sociology aspects that you mentioned. So thank you again for doing this.
You know what? Thank you. But I think you also would enjoy the sciencey part, because believe it or not, public health is that one discipline that actually intersects into other disciplines as well. So you get that social work, you get that sociology, you get that biology, biomedical. It really is that flavor that gives a little bit of everything. So by the time you're getting the science, you're enjoying it so much you don't realize it's science.
Well, we'll see. How about that sound? I see a question in the chat from Patricia McQuaid, who asks, do public health majors frequently double in another major? And if yes, what are the other majors that you are seeing?
Well, I guess I'll leave because I can't really participate.
So one of the things I find, they don't have a dual major, but they do tend to have a minor. And those minors tend to be in some of those interdisciplinary studies like psychology or biology. So apart from those public health programs that I listed, there are a set number of recommended electives that public health students have to take. And those electives are in psychology, biology, sociology. And so they tend to have minors in those areas. One of the things that Dr. Jennifer Cooper, who will soon to be the chair of the nursing department, was interested in perhaps what we might be able to do in offering a minor for nursing students who might be interested, or other students. Because it's so early on in the program, I would say we have to focus our efforts on the major first and get to that accreditation piece. And then definitely that could be something to consider. However, in the realm of accreditation, public health minors are not considered.
All right. I'm enjoying learning about the growth of the program, so that's interesting to know. Just from Leslie Wilkins Pruitt, she just said, thank you for this presentation. Much continued success, and she's looking forward to following the progression of the program as well.
Thank you.
We've got a lot of alum support out here, and I'm going to use that statement to segue. You mentioned having guest lecturers to come in your class. And so we love having a task over here in alumni relations. I'm going to start to really dig and canvas for some folks, and maybe we can talk about bringing some dynamic alums to your classrooms.
That would be perfect. I actually had the pleasure of having a former Hood alum, Dr. Nicole Hoff, who served as a guest lecturer.
Yep.
And she presented from the Democratic Republic
of
Congo.
Oh yeah.
The great work that she's doing. It blew the mind of the students. And one of the things that was interesting as she was reporting was how, they have a plethora of other issues that we don't have, but their COVID cases, their numbers were really low. Yes. And so that was one. So I try to, as I'm interacting and meeting individuals at the college, incorporate their expertise, and especially, rely on that of former alumni.
Well, I have to tell you, we all know that Nicole is one of our superstars, and I love that you all were able to connect and really present to your students. That's fantastic.
Yeah.
Kelly, can I just add something to that?
Absolutely.
when we were developing the public health major, this was life before Sherita Henry was ever on campus. We reached out, the first place we started was to our alumni who have experience in public health currently. And it was really the alumni voice that helped shape the curriculum we have today, because it was from their perspective that we learned the power of leveraging the liberal arts. It was the alumni voice that compelled us to pursue Bachelor of Arts versus Bachelor of Science in public health. And so I just want to acknowledge that we would not be here with this program as strong as it is. Certainly Dr. Henry's leadership has taken it to the next level, but I really acknowledge the foundation that our alumni base helped us build this program. They were significant.
I love hearing that. Thank you,
She
Debbie.
was very committed. Yes.
She is an amazing.
Awesome. She was very committed. It was the health, behavior, and theories aspects, social and behavioral theory aspects of public health. And so, you know, those sort of application pieces get the students thinking like, what can I do with this major? You know, sky is the limit.
I agree. And this is a perfect segue question from Rachel Brown. She is class of 96. She and her husband Roger they tune in from Wales in the UK. So we always like to acknowledge that they've traveled the farthest. So Rachel asks, do the public health students do any placements abroad? And I know that would fall under the experiential learning category.
Right. Okay. So excellent question. We are not quite there yet with the program itself sponsors a study abroad, but that is the goal. Many established public health programs typically on a winter mini-mester will travel to different places and provide local health services as well as education. But what we do have is students who based upon their scholarship award, who are public health students, they get to use that scholarship with study abroad opportunities or external internships through mentorship. But currently, the Department of Nursing has been responsible under the leadership of Dr. Jen Cooper of hosting study abroad opportunities whereby public health students are welcome to attend. And I think the most recent initiative that Dr. Cooper was working on was Belize. Unfortunately, it had to push pause because the COVID numbers there were too high. So until we get to the place where we can sponsor our study abroad, we'll tag on to the nursing department as we're housed in that program to expose students to the different type of global health initiatives that they can be a part of.
Yeah, because there are certainly various things that affect public health in different places.
Right.
You know, in some countries, it's stress due to overwork. In some countries, it's, you know, cholera and what have you.
Right.
And so it sounds like it's an awesome opportunity, like going to Belize and other things. You know, I know here we have the National Health Service, which I will say it's not free medical care. It's free at the point of use. We pay for it through our taxes.
Quite a lot, actually.
Yes, we do. We pay a lot of tax, but I mean, I'm incredibly thankful for it.
It is very good, just even though it's a public system.
Yeah. And so it would just be interesting to see if any students look at comparisons between places where there's universal coverage versus not, and how the outcomes come out differently. I don't know what the different outcomes would be.
Right, right. So that is an excellent point, because in the PH 102 Introduction to the U.S. Healthcare System, we actually look at some of those differences, you know, for the different nations that have that universal healthcare coverage compared to those that do not. So in terms of the experiential side of seeing some of these places, I think that would be amazing as well. And I really look forward to, you know, those sorts of global initiatives, because it is very, it's really the cornerstone of most public health programs, that you can count on at least one time a year that there is some sort of study abroad. But it's not just for fun, it's providing key services that the indigenous people rely on. And it's really allowing them to get that hands-on experience to provide that service. So I look forward to that piece, and we'll have to stay connected to keep you posted.
The United Kingdom is particularly good for the health services because it's all embracing, and there's no differential between how much you earn or what social status you are. It's available to every single person. If you choose not to use it, then that's your decision and you can go private. But many people who you find that actually some of the services you get from the National Health Service are actually first class, and they're better than you can get in the private sector.
Yeah. And also, I think from a nursing perspective, I mean, I'm not a nurse, but I get the impression that doctors and nurses in countries where there is universal coverage are likely to have a broader range of experience, because here, anyone with anything can walk through the front door of the ER. And so, yes,
Just laughing about something, don't worry.
yeah. If you want to see fun, go to the ER on a Friday night and
Oh, wow.
yeah, but because anyone can walk through the front door.
Rachel's just the only reason she mentions it is that I dislocated my shoulder rather late on a Sunday evening, and we were there rather a long time, so we saw a very wide cross section of the human populace pass through the although the service was still very good.
Yeah, but one man didn't want to tell the triage person what had happened because the police officer was standing next to him.
Yes.
That
And another one.
Our first study abroad, once we launched the program, UK, there it is. We'll have to talk offline. Typically, local dental initiatives or blood pressure screenings, health education. Those are the things it's kind of centered around. But again, based on the location, it's the need, the health need of the community that we're seeking to serve. But that sounds like an awesome opportunity. I've not yet been.
The first thing I thought of was, I wonder if they have HIPAA regulations over there. It sounded like a little too public in that ER, Roger.
Well, no, nobody gets treated in the. I mean, you get taken aside to do whatever it is necessary.
That's good. That's good.
But the main issue is it doesn't matter whether you've got any money or not. I mean, you just walk in and someone will assist. And actually, if you have a very serious medical issue going on, the service is first class. If you have I don't want to take over, but if you have a chronic ailment, it's probably a little less good. But as Rachel said, because a national health hospital has to deal with everything, it's often better than a private one because private ones only specialize in certain areas.
And so they just don't have the breadth of experience.
That's right. And sometimes things go wrong in private hospitals and they have to transfer patients rapidly through to the National Health Service.
Then the NHS has to fix it.
Yeah, they have to fix it.
Yeah.
Wow. Very fascinating. I'd love to connect offline.
Okay.
Well, I want to be very respectful of everybody's time. And so I'm going to do what I call my last call for questions or comments for Dr. Henry.